Hello friends, how are you? Once again, I'm Indra Cidambi, the psychiatrist from the United States of America, bringing you a new topic today, which is about the smoking cigarettes. Smoking cigarettes, before we jump into what it does to our body and why we shouldn't smoke, please subscribe to my channel and also do not forget to press the bell button. All right, now let's really jump into this topic of smoking cigarettes. Cigarette smoking. You might be thinking, oh my God, we all heard it enough. I'm not going to quit smoking. It's just what I want. I will take care of it. I've been smoking for 40 years plus. No cancer. Lady, walk away from me. Enough of your lecture. It's okay. It's okay. Spare 10 minutes with me. Just your 10 minutes. And if I can make one cigarette drop off from your hand, I still succeeded. That's my goal. My friend, just give me that 10 minutes. Right? Let's really talk about it. When someone takes a cigarette and lit it and it starts burning and they take it to the lip, they have not even inhaled yet, but the damage started right there. The nicotine and the chemicals in there fumes up. And what it does, it stains the nails. And when they put it on the lip, it stains the lip and discoloration happens. And it also, the fume kind of spreads to your face, the skin. And if you have wrinkles starting, light lines, ladies, those who are spending so much money to take care of your external beauty, here you go with your one cigarette. You're going to really ruin it because those lines are going to get lodged with these chemicals and they dry up and you would see the accentuated wrinkles. So the skin is so easily prone to wrinkling due to your cigarette smoking. And now when person inhales, what happens? They inhale, and before they inhale, it even can affect your eyes because the fumes touch the eyes, you get the blurry vision, and that's all you know, but then you can develop cataract from that. When they inhale this, what happens is, now it's in the mouth, and it goes into the nose. So let's first talk about the mouth. What happens in the mouth? When cigarette smoke touches your oral cavity, it's going to coat it, the tongue and the mucus in the mouth, and so you lose the sensation of taste. So you are no longer tasting food. So what's the point, my friend? Why are we doing this? We all experienced this when we got COVID. How terrible was that, not to be able to taste your own food? And this is something that this cigarette smoking can bring forth. And then when it goes through your vocal cords, which is the sound box, it's going to affect that. And you would get the very rusty voice. And then later on, it's a high risk for developing a laryngeal cancer. Oral cancer, I've seen patients with holes in their mouth, terrible kind of tumors and leading to cancer, by smoking and chewing tobacco too. We'll talk about that. So after it goes past the oral cavity and goes into the food pipe, again it can cause cancer, and it touches the stomach, and it's not a good news. As it is traveling, it's going to cause a big problem with the blood vessels. The blood vessels in there gets thickened, and also all the platelets get sticky. So the oxygen supply to organs gets really cut off. That's not a good thing, my friend. It's just not good. Hey, if you have children at home, you've been exposing them to the secondhand smoke. They can develop asthma, infectious disease, ear pain, ear infection, and they can have the throat infection, all from secondhand smoke. Pregnant women can develop fetal, disability there. The fetus inside the pregnant woman gets exposed to the secondhand smoke, and they can have low birth weight. And also these babies can have developmental disorder. And if you have elderly parents in the house or elderly people that you're caring for and you're smoking, the secondhand smoke, the secondary exposure to the smoke, for these elderly people who are there at home, they are going to suffer from, ton load of infection. They are very much at risk for pneumonia, and you are going to contribute to the thing. And their blood, when you smoke, and those fumes, the secondhand smoke, can even cause bone fragility in elderly people. And as it is, elderly people are at risk for breaking their bones, taking a fall, and that is, in fact, break of a bone can lead to their death. So we really don't want, if not to hurt ourselves, definitely, if not for you, you're hurting other people. You're hurting other innocent people, day in and day out. I beg you to please drop that cigarette. Please drop that cigarette. There are ways to stop it. It's not willpower, and there are things that you can use to quit smoking. Now that this blood goes through the system, right, it goes into the liver and it breaks down. All the chemicals from the cigarette, nicotine, breaks down in the liver. It can cause liver cancer, and now it can lead to pancreatic cancer, and it also goes into your colon and can cause colorectal cancer, and it's also going to affect the kidneys. Through the kidneys, when the liver breaks down these chemicals and the nicotine from the cigarettes, it passes through the liver and then breaks down, and we pee them away. So we, kind of urinate them and we get rid of those things. But before that, it affects your kidney. You can have a kidney cancer. Now, if this is all not enough, let's see where else the cigarette smoke goes. It travels through your nose. In the nose, you lose the senses of smell, which we all experienced again when we had COVID, right? Most of us. That's not a great feeling. We waited for it to come back. Here we are with this cigarette smoking going to create this kind of a mess. There are cilias in the nose. It's like the broom, right? The bristles in the broomstick, it kind of does the same thing, it filters. And a large particle from the air that we are inhaling, when it goes in, it gets filtered. So our lungs are not exposed to big particles and foreign bodies. So that's why we have cilia hair inside the nose. But unfortunately, by smoking, we are going to kill that protective system. And that leads to a great risk of exposing our lungs to unwanted particles without getting filtered, right? And so from the nose, it can also travel into the lungs. So once it goes into the lungs, it causes COPD, chronic obstructive pulmonary disease. So COPD is a big thing for people who are chronic smokers. So we really have a big issue there. Consistently having pneumonia, lung infection, lung cancer. It's like really, if you were to look at these lungs, which has been a smoker's lung, it feels like, the trash that when you smoke and you have the, smoke dispenser and you're not ashtray, and if you're not cleaning it, and you can see how, stained and garbage looking it is, like yucky looking, the same look of your lungs in there. And why do that to our lungs, right? Poor lungs. And then it also goes through the blood system, it travels to the heart. The heart, it can really cause deficiency of oxygen supply to the heart muscle, which leads to the heart attack and, ischemia, as we say. If it goes into the brain, it's going to cause stroke in the brain, small vessel strokes, lacunar strokes, or the large vessel strokes. So, memory problems, right? You name it, we have it. And the eye, it can even cause macular degeneration, and it can lead to blindness, right? Constant exposure to smoking. And when you talk about all those things, women, we have to be very careful. We as females have so much to do with the reproductive system. And you know, these smoke, when it gets into our body, damages the reproductive system too. The cell count goes down, like, you know, your the egg quality of the egg goes down, and it's an infertility eventually. And people with smoking also suffers from reproductive issues. If they were to be pregnant, that is it, ladies. If you're pregnant and if you're smoking, the fetus can get affected. Low birth weight, a ton load of developmental disorder. My goodness, I've been speaking mouthful about the damages that this cigarette causes. Do we need it? If this is not enough, let's talk about secondhand smoke. Oh my God, I'm not smoking, but I am surrounded by people who are smoking. Or my spouse, say for example, is constantly smoking. My children are at huge risk. They can have asthma attack, ear infections, and they can have constant infections in their lungs. That is just from the second-hand smoke. And if a pregnant woman is with people who are smoking around, surrounding her, that can lead to the fetus getting exposed to those fumes, and the same effect that I was talking about, low birth weight, premature childbirth, a lot of developmental disorder. So it's as bad as you smoking if you are going to be exposed to the secondhand smoke. So you come to understand after watching this video, for sure, smoking has got no room in our life. Smoking has to, absolutely stop. Friends, if you are smoking, please don't do harm to others. Please stop. If you want to quit smoking, if you made up your mind, the next video, I will be talking more about what we can do to quit smoking. On that end, let me end this video. Thank you for your time and thank you for watching it. Please share this to more people and ask me what topic you want, and I will come up with a video. Thank you. Have a nice week. Bye-bye.